South Africa needs to block the routes that enable the transmission of COVID-19 in order to get the virus under control. Well, that's the view of a group of experts from Wits University. They're saying now that lockdown is relaxed, other strategies need to be used to stop the spread. So for more on this, we're joined now by Professor Alex van der Heever. He's the Chair of Social Security at the Wits School of Governance. Prof, thanks a lot for joining us this evening. You're saying we need to re-strategize. What kind of strategies do we really need to put in place?
Well, we essentially need to concentrate our efforts on the areas where spread is going to be greatest and the highest risks will be for transmitting the epidemic. These were always where our strategy had to be placed. But other features of our strategy, such as testing and tracing, haven't reached the scale and level that would be required to suppress the epidemic. And the lockdown itself is not going to be successful in many areas of South Africa, and it also can't be sustained for a very long period. So essentially our focus has to be on those bridges between communities. And these include shopping centres, areas where the community gets together. So firms, they have to be open, but you have to manage the epidemic in those areas. Bulk transport, etc. And we're seeing within the epidemic now that quite a lot of transmission occurs exactly through those particular bridges between communities, hospitals, shopping centres. And those are the areas where we have to focus our efforts.
How then do we start practically implementing efforts to focus our efforts on that? And simply because, I mean, going to a mall, and right now we're going to have restaurants that are going to be open for sit-in. People are going to be going to the hair salon and personal care services, which means that, you know, unfortunately, more and more people are at risk of exposure if care is not taken.
So one of the big risks of transmission exists in areas that are poorly ventilated. So enclosed spaces are always going to be high risk, even if you're wearing a mask. Areas with good ventilation or outside areas are a lot safer. So any situation where you're going into an enclosed space where the air conditioning is, for instance, circulating air within that environment is potentially high risk. There's been a case in the United States where people went for a night on to a bar for the evening, 16 people infected on the same day. So it's those super spreading events that actually are really responsible for escalating the epidemic. So it's really those particular risks that have to be contained as far as possible. Even if not eliminated, you want to eliminate the super spreading.
Prof, here's an interesting finding. It says that 80% of COVID-19 infections are attributed to 20% of infected people. And more interestingly, the finding says that roughly 70% of people with COVID-19 did not infect anyone else. So where are we getting the infections?
So it means that a small proportion of people, that's a so-called reproduction factor that everybody looks at, R0, is really a very crude average. And in reality, a large part of the reproduction rate is, in fact, a very small number of people who spread the disease to a very large number. And this is also the finding that we're seeing it in South Africa as well. Certainly a number of investigations in KwaZulu-Natal as well as in Cape Town indicate that a single person is responsible for a massive number of subsequent infections. So if you can minimize the risk of super spreading, you're potentially bringing the reproduction rate of the epidemic down because the other people aren't necessarily spreading it.
Sure. And then on the other side of it, we've got this issue around social distancing. I mean, this is all about behavioral changes, unfortunately. And the question is society at large adopting these regulations and restrictions that have been articulated by the government? So we essentially have to keep communicating the interventions that work. I think you would have noticed that a lot of the interventions have been subject to investigation over the last 4 to 5 months, and so sometimes the advice has been changing. I think what is becoming clear is that being a lot more cautious is better than being incautious, and wearing a mask will be helpful in many situations, but it won't necessarily be sufficient to protect you if you're in an enclosed space with poor ventilation. So avoid areas with poor ventilation. Even if you're social distancing, it may not be enough to protect you if you've got poor ventilation. So those become the kinds of things we have to start looking at very carefully. The risk of getting it in the air is potentially very, very high relative to, for instance, from a surface. So you want to really emphasize the high-risk spaces. And so restaurants that are, for instance, open to good ventilation and to the open air may be a lot better and a lot safer. Couple that with a reasonable degree of social distancing and the wearing of masks, noting that in a restaurant it's quite difficult to keep a mask on while you're eating, but as far as possible is better protection than going into an enclosed space and thinking you're safe even when you're wearing a mask.
Definitely insightful. Professor, we're going to leave it there for this evening. Professor Alex van der Heever from the Wits School of Governance, speaking about re-strategy, really, when it comes to being able to tackle the scourge and the spread of COVID-19.